and happy Friday to another session with Having Coffee with Dr. Munné. Good morning, Dr.
Good
Munné.
morning, Adrian. Good morning, everyone.
Yes, thank you for tuning in. And this is another special episode that we're having now that everybody is getting back to normal, getting back to school, getting the kids ready, getting the school supplies, everything that is needed, and to get back to this m- always moving
Routine.
routine, right? So it is great that you enjoy the summer. We hope you enjoy it. We also want to congratulate the winners, Spain. Oh my goodness, that is amazing. Great
Yeah.
job. Consistent in the field, very, very polite in the way they played, very elegant, very clean. We also want to congratulate the big ones, Argentina. They did amazing. This was Messi's last season,
Yeah.
2026. So for those who have the opportunity to go see all these amazing players, it's going to become history. So thank you so much. And all this amazing work they did on the World Cup FIFA 2026. And now we're getting back into business and to all these aspects. What do we need now, Dr. Monet, mentioning why do dental problems seem to appear after vacation?
Wow. Good question, right? Seems like after vacation, we always have that, all those emergencies in the office. I think that number one, it seems to happen more after vacation because maybe some issues that should have been dealt before, that you're aware, you've been postponing and procrastinating, and then you go on vacation, and then that's just like about 2 weeks too long, and just it just doesn't hold anymore. Whatever it is, it's just an infection, a decay, a tooth that breaks, a crown that comes off, a tooth that comes off. So I would say number one rule is do not procrastinate and make sure that you take care of your problem before going on vacation, because the worst thing that can happen is that you're on the other side of the world or on a beach or somewhere, and you have pain, or you need a dental emergency, and then you have to stop your vacation and try to find a dentist or somebody there to take care of it. And you also don't know where you're going, how is it going to be taken care of. So don't put yourself at risk. So try to get everything done before. And also, accidents happen too during
That is
vacation, right?
correct, a lot.
We run our speed a lot faster than we go on normal time, so we might do some activities, the kids, right? Activities. So there's a lot of also children's emergencies after vacation because they fall or they run into something.
They're just
So
too much time at home, right?
yeah, exactly. So those things are common, but I would say, try to avoid accidents, and then try to address your dental needs before you go on vacation. So when you're there, you're not, finding yourself in a predicament.
That is correct, Dr. Munez. So just, everyone's just catching up to get back to the routine. Remember, your checkups are very important. So this is the week where you can actually schedule your dental checkups for your kids, for yourself. Make sure because once you get back to work, some of you already got back to work, or some of them, some of you guys didn't have vacation, but this is the time where you can actually schedule those, have all of your kids check up and everything. So it won't mess up with your schedule once you jump back to full force and to full work and all of that. So that's something very, very important. Now, just to mention, now, can a missing flossing for a few weeks affect the gums?
Absolutely. Missing brushing or flossing a few times is going to affect your gums. Sometimes we have patients that, they come regularly, they're having their regular maintenance appointments, and they're doing well, they're well maintained, they're stable. And then they come back for the next cleaning, and then everything just looks bad. And
Yes.
there's inflammation, bleeding, and all these issues going on. And then they go, well, I was out of town, and we understand that when we're out of town, our focus might be a different one. We're busy, we're traveling, we're having fun, or we're busy with meetings at
Adventuring,
work.
yes,
Yeah, it
yes.
could be it could also be a work related trip.
That's
But
right.
because you're busy and you're not thinking about it, your routine is broken. Now you're not like you're waking up at the same time and go to bed at the same time. Now your routine is all different, and you're, missing out, just doing it maybe faster, or maybe missing one here and there. I got to the room, I was tired. So missing a little bit actually can affect a lot, because some patients depend a lot on that regularity. So it depends also on every person.
Yeah.
Every person has a different set of genetics and a different set of immune system of defense mechanism. For some patients, they might be able to get away a little bit more than others, but for some might be disastrous. So I would say just try to do your best when you go on vacation, and still take care of your oral health the same way you're gonna shower, you're gonna do your hair, or
That's right.
your
That's right.
makeup. Just make sure you also do your teeth exactly the same as when you're at home. That way we can maintain and just decrease the number of problems, and definitely the investment, right? Because everything is just have an impact also on additional treatment necessary. So the more stable you are, the less financial investment you need to have, to make sure that you go back to normal.
That is correct, Dr. Munez. Thank you so much. Now, talking about the investment, what should parents check inside their child's mouth, before going back to school, before getting back to normal and routine? Is there any specifics that we should be aware of before getting back to school?
Yes, well, I think that coming back from vacation or before, parents should always be in tune, right, with what's going on with your child, and also inspect their mouth. Look at their gums. The gums are supposed to be pink. If they're not pink, then that means that there's a problem. If you see them a little bit more red, or it might be that maybe it's one tooth that is more red, then you need to look at that tooth. You need to make sure that you call your dentist and see why there's redness there. It could be an infection. Sometimes there's, teeth that have, gum problems as well. Children can have gum problems too. And of course, look at the teeth. If you see any discoloration that is not normal, some things that are a little more white or more yellow, more brown or black, those are, the different stages of the decay. And then from there, it's going to start having a cavity, like a little hole or a big hole.
Mm,
So anything that is not white and is not pink, and you see, might be a problem. Also, when you're inspecting, don't look only at the gums and the teeth. Look at their tongue, look at their palate, look at their lips, look at their throat. Just kind of have a little bit more of broad view, just making sure. And you can also touch and palpate a little bit, just see if it's something sensitive, and check that. But of course, nothing replaces like a good professional, that can do a great exam and tell you if there's
correct.
anything that needs to be corrected.
Yeah, Dr. Munez, you make it sound so easy. It makes me want to go and check on my kids and everything. But yeah, of course, a professional will help you because they will analyze it. They will basically tell you more specific on what could be the cause of it. So just remember to tune in with your dentist. If you don't have a local dentist, remember you can look us up at for healthy gums for number 4 healthy gums for all .com, and you can find more about this practice, more about the location, and more about the different services that we provide to you. Okay, so next and last question is like, how often should the children and teenagers and ourselves replace their toothbrushes or our toothbrushes?
Well, I think that adults or children, the toothbrush should be replaced, the same way. If they brush the same way, if the child only
Right.
brushes once a month, right, then of course it's not necessary. But I think that if the patient, regardless of the age, brushes, every day, twice a day, that's the minimum that you should brush, then the toothbrush might need to be replaced every 3 to 4 months. You can look,
Okay.
sometimes patients brush very hard, you might need to replace your toothbrush sooner. But I would say if you clean your brush after every use and you make sure it's dry, so bacteria doesn't continue growing there, you just wash it with hot water, and just clean it well, then you should be able to get that long, or sometimes maybe a little longer if it looks good. So just kind of look at it. But if you see that the color in your brush starts going away, and
That's a
then
good point.
yeah,
Yes.
sometimes the bristles have different colors and they start kind of fading together. Then it's time to
It
go.
is the
Yeah.
time. Yeah.
Hmm.
You're using it too much. Thank you so much, Dr.
Hmm.
Munné, for this session. Such, very important points that we should, take a look of and listen to it later. Do not forget to like us on Facebook, Twitter, YouTube, Instagram, TikTok. We're in all those different channels where we post content weekly. We have stories, reels, easy to understand, easy to read, and please share them around with all your family and everyone because this is important and this is basically something that can save you so much in the long run on your dental health. So thank you so much again, Dr. Minet, for having us today.
Thank you, everyone. Enjoy your weekend.
We'll see you around. Happy weekend. Take care.